Hello and welcome to Sheila Lives Out Loud. My name is Sheila Moniga. I'm super thrilled you found this channel. Please click subscribe and hit notifications. And as always, drop a comment at the bottom. Let me know what you feel about this video and please share it as well. And in this episode, we are requesting that you actually do share this video because we are having a conversation with Dr. Simon Kigondu, the Secretary General of the Kenya Medical Association, on all things coronavirus. Daktari, hello, how are you?
I'm very good.
Thank you so much for making the time to have this conversation with me. And I'd just like us to jump straight into it with understanding what the coronavirus is and what COVID-19 is.
COVID-19, as I said, is a short form for corona, V, virus, D, disease, 2019.
Right.
Coronaviruses are a group of several viruses, but this particular one that is causing an infection, a pandemic across the world, was specifically described as one of the coronaviruses, and the disease started in 2019, hence COVID-19. So corona is just a group of viruses, but this particular one is coronavirus 2019 that is causing the disease that is causing a pandemic.
I see. So one of them is defining the disease and the other term is really just defining the virus itself. Moving on to symptoms and signs, what is the difference between a flu and having COVID-19? Because not too long ago, everybody was saying, but it's just like a homa, it's like a flu and it passes. But clearly there is a distinction between the two.
Coronaviruses do cause flu-like symptoms. Now, how does a body reacts to a foreign body the same way? It reacts to, for instance, if something is, and this particular one is a foreign body that affects the nose, throat, and the lungs. Yeah. So when the body, you have some irritant, so to speak, whatever it is, it may be a virus, a bacteria, or it is, the nose will react by producing maybe sneezing and a running nose. The back of the throat, which is a common place where specimens for this coronavirus are taken, react by, you get that irritation and you may get a dry cough. And now if the coronavirus reaches the lungs, it may attack the lung tissue and destroy, causing what is called inflammation of the lungs, which is a pneumonia. And if the lungs are inflamed, then the air exchange is not occurring very well, and you may start getting difficulty in breathing. Because if you have a part of the lung that is damaged, then the oxygen exchange and carbon dioxide excretion is not good. Therefore, people sort of try to gasp for air. That is lung damage, is a pneumonia. So the signs are the same. So when a body gets infected, then there is something called cytokines, which are things which go to make the body, therefore you start getting a fever, things which trigger fever, that go to show that maybe there is an invasion by a foreign body that is generally not supposed to be there. And therefore the common signs are these ones. In this particular one, and as we said, there are some coronaviruses cause flu-like symptoms. And what are the flu-like symptoms? Our usual flus of sneezing, cough, running nose,
headache as well, I think.
Headache may come if it invades the sinuses. So these symptoms may have similarities. So what we are saying, when you get this particular one, you may actually get similar symptoms. But we now need to really see, where did this person come from? Are they coming from a place where this has been described as a pandemic? For instance, initially it was China, then proceeded to Italy, now the whole of Europe, and now slowly by slowly, it's getting some African countries. Like I think the highest currently is South Africa. And now in Kenya, we have several people with a positive test for COVID-19. Therefore, the case definition keeps changing, and it's going to start including places like visiting a positive patient in Makati, for instance, and therefore that is the situation.
Okay. Now, thank you for describing those symptoms because a lot of people, someone sneezes and it's pandemonium. So,
Yeah.
if, say, you have been exposed, I know a lot of people are self quarantining. This word I'm telling you, it's quite special. So, there are a lot of people who are in self isolation. There are people who are talking about social distancing. There's so many new terms that are now part of our new normal. But before we talk about the terms, I'd like us to move very quickly to how the coronavirus spreads.
Good, yeah.
Yeah, because if
So
it has flu-like symptoms, then maybe it's the way it transits from one person to another also includes those classic flu-like means.
yes. So the classic for the virus to enter your nose, throat, mouth, then the virus has sort of to be transmitted to the nose and the mouth. Yeah. And how that is done is that when the virus is found in droplets is like if you ever see someone sneezing, then all those droplets of saliva and mucus sort of the virus is there, and it may land on a surface. So it may land on a surface where if someone touches that surface where the virus is there, then touches the nose, then breathes in, then the virus can actually land on the mucous membrane of the nose and the mouth and start multiplying there. If someone sneezes directly at you and you see droplets, you can actually breathe in these droplets. And therefore, the primary prevention is actually preventing contact with these droplets.
Okay.
You see?
Right.
And how do you do that? One thing that we have recommended is that avoid droplets, wear mask, for instance. Ideally, if I was to give a recommendation, I would actually recommend that everyone keeps their own droplets by having a mask. You can make it out of old clothes and all. So if everyone walked around, then they reach a time where these droplets are not being transmitted from person to person. But what they are saying is if someone is infected, avoid direct contact with them. And that's the concept of quarantine. The concept of quarantine is remove the person who has active infection. And because we may have a window period where we don't know someone who is infected, then if people who are kept away may be people who have traveled, and there's the possibility that they may have come in contact with the disease, and therefore you keep them away for some time. They have also said that this virus, if you wash with soap and water, then the soap helps eliminate the virus, and water also washes it up. So good hygiene practices prevent these droplets from the virus from coming in contact with you. 60% alcohol and above then is also effective in cleaning the bacteria.
This is using those hand sanitizers.
Sanitizers are a hand sanitizer basically is alcohol with a stabilizer, like glycerin, so to speak, so that it's able to. But other people have also been using literally alcohol, like spirit. Yeah, as long as it's 60% and above, and this helps prevent this virus, so to speak. So the bottom line is that these droplets should not come in contact with the person who is not unwell. And therefore, to prevent it is a physical barrier, like a mask, a physical barrier. And then they also say that chlorine and maybe bleaches, they sort of clear away these viruses. So they are encouraged, yes, to clean surfaces. You won't know how many times you touch surfaces and yourself. And therefore, part of the prevention is actually cleaning of surfaces and this chlorine and jig and keeping that.
Okay. I remember reading somewhere that you don't touch those lift buttons. In fact, right now, if you can avoid an elevator, that would be the best thing for you. Because, the people who are touching these floor buttons and the open and shut buttons, and maybe they just coughed into their hands, which is one of the worst things they can possibly do right now.
Yeah. And because there is sometimes it's inevitable that you may need to touch a lift, open a door, and it's advised that when you reach your place, then you hand sanitize or wash your hands with soap and water, and you are seeing these catching up, and also the people charged with taking care of buildings should actually put hand sanitizers next to the elevator,
Right.
so that
I know I saw that next to ATM machines, which I thought was a very good idea.
Generally, where people will touch a lot, then you put a hand sanitizer so that people use before and after.
Okay, let's just talk about how long this coronavirus exists outside a host. For us to be mopping and cleaning means that it's not enough for it to just be hanging in the air or to drop down on the ground. It has a shelf life. There's a limit of time it can survive before it moves from one host to another.
Yeah, so they have described the various surfaces, how long the virus may be on surfaces. And actually, like stainless steel has been shown to actually be quite some time, maybe up to 3 days. Right. So on different surfaces, I may not remember the exact numbers. I will check that up, but they stay there. So we assume that on these virus is on these surfaces. So we advise that you actually clean these surfaces, both wood, metal surfaces, and generally any surfaces. So yes, the virus has been said to stay on surfaces for some time, and that's the reason it is able to spread.
Okay, it's just going back to what our mothers always used to tell us. Nikikupata ukishika vitu utaniambia. So moms told us, don't touch things. Don't touch things. And in fact, don't touch your face. But moving from the virus and how long it can exist, let's talk about the terminology currently in place. So the people who are in self-isolation, we know there have been a lot of airline crews and passengers as well who've been put in quarantine. So when we talk about self-isolation, quarantine, and social distancing, help us understand these terms.
So maybe directly, let's start with the people who, for instance, came from abroad, maybe had traveled to Italy, and came and they had symptoms. Yeah. So someone has come, history of travel abroad, is having a dry cough and maybe running a fever. So some of those are those who are actually tested, and the test is taking a swab from the nose and the throat, taking it to the Camry labs. Our labs are pretty good, by the way, and they do what is called a PCR test, which takes some time. And when it returns positive, that means that this particular person is harboring the virus on the nose and the throat and can actively transmit. And therefore, such a person, you put them in isolation. And in that isolation, there are precautions that are taken to avoid them transmitting. The first thing is keeping them away from the rest.
From everyone else,
monitoring them to see that they do not progress. The main aim is to see that they do not progress to the stage of pneumonia and respiratory distress, which can lead to death. Even the people who go seeing them, they sort of need to don personal protective equipment for even feeding them or so isolation centers have been done. Then there are those who have not been tested, but are like, for instance, those who recently are said to have come from places where there is active COVID. Therefore, now what they decided, you can actually be told now, because you do not have symptoms, you need first to go and keep yourself away from the others for about 14 days. Because after 14 days, it is envisaged that your body has survived it and built antibody, and now you're not infectious. And you're told to go home and quarantine. That's called self-quarantine, which is one of the methods that has been used. But now it was shown that sometimes self-quarantine, voluntary self-quarantine, people have breached that. And therefore, the government has established what are called quarantine centers, where now you go, it's like supervised quarantine, so that you do not go mixing with everyone. And after about 14 days, we would release you if we suspect that you are now not able to transmit to the population. And that's the basis. And that's the basis of this quarantine issue. Quarantine is not a new concept. Tuberculosis, we used to quarantine. In Isiolo, for instance, where I was some time back, there was a TB manyata. You get TB manyata, meaning that you are kept there and they give you direct observed therapy daily for about 6 months. And when you heal, you now go back to the community so that TB is not transmitted within the community.
Right.
It's a very good concept. And ideally,
it's difficult, of course, for the person who has it, but it helps keep the others safe.
Yes. It actually helps you keep your, for instance, if I go, I have it, and then I go to my family, then you will have infected your family, and then they will go and infect others. And that's how that curve starts going up. You had one who infected one other person. So now there are two who infected two more, they become four. And then the four infected four more and they become 8. And now when 8 is 16, and when 16 starts, the curve starts coming. And now when many, it becomes difficult to control.
Okay. There's one more expression, social distancing, that I'd like you to address before we talk about two very crucial things that you've put on the table for this conversation. So let's finish with social distancing. I think you have a problem with social distancing and a new terminology for that.
Yeah. So what they were trying, what has been described, maybe sometimes the English words do not describe that. What they meant with social distancing is actually physical distancing, meaning that when you stay, like, at least initially was defined as a meter away from people, because you see, if I am a meter away, even if they are droplets, then they do not reach the next person. Droplets, yeah. Right. So actually, the terminology we would like to use and has been used a lot by what is called Professor Atwoli, is actually the one who is in the mental health space. So he has said, specify physical distancing but social togetherness. You get what I mean? So that people may stop talking to each other if you tell them about social distance, but actually what you mean is that they need to keep some distance, physical distance away. So probably the term that needs to be propagated is physical distancing but social harmony or togetherness, so to speak. Yeah?
Understood, and it makes a lot of sense. Now, in this conversation, you've talked about 14 days, and it takes a bit of time for the test results to come through. Why does it take time, and who came up with this 14 days? Can it be less than 14 days?
Yeah, so these 14 days has been looked at by the natural history of the infection with coronavirus 19, COVID-19. Yeah, so they've mapped it out and they've seen that when you get infection, then you get about 2 to 5 days to before you get symptoms, and then it peaks and then it goes down. The body starts making starts generating an immune reaction against, and then now by day 14, they now say that you have sort of recovered, so to speak, and therefore you are now not transmitting if you've recovered, and that is general. So these guidelines that are given in terms of days are dependent on what is called the natural history of the disease. Yes.
So testing and why it takes so long. How is the process? How do you test for COVID-19, and why does the process take several days?
Yeah. So the testing is simple. You go to where you think the virus is multiplying, the back of the nose and the throat, and this is the people taking a test have to wear that spacesuit. It's called a hazmat. So to prevent themselves from getting the disease, then they take a specimen from the suspect, and it's put in a viral transport medium. This viral transport medium is kept so that to preserve the material from, if you expose the material to sunlight, or then you may break out. It's taken to the specialized labs who do what is called a polymerase chain reaction. They go and put it in the media, grow it, so to speak, and then they go and look at it under a microscope and say, this is actually that particular virus. And that takes time. And that's why we've been having a bit of slow increase in the number of labs that can do it, because it's slightly specialized. And then the test media need to be available, and which is sometimes not very helpful. And
It's
therefore,
also
it takes
a
a
challenge.
minimum of
Exactly.
6 hours. A minimum of 6 hours. Yeah.
Great. Okay. Now, I'd like us to focus on the misconceptions of the coronavirus because, from what we've been seeing globally, a lot of the elderly have been severely affected by COVID-19. And it's got a lot of people thinking if I'm under 40, I'm under 30, then I'm invincible. I've got a hope. But this is just for elderly people. So please leave me alone. Let me enjoy my life. And maybe to some extent, that's why we have curfews. That's why, a lot of the world is also on lockdown because people weren't taking it as seriously as they should. So is COVID-19 something that primarily affects old people only?
Actually, coronavirus can affect anyone. Yeah. And it affects everyone. Now, the catch is that 80% of those affected by COVID-19 will get mild symptoms and will recover fully. So sometimes, if the pandemic was not around, you may not even know. You may actually do that flu thing and say, I had a bad flu, but I recovered. Of the 20% who are severe and may need hospitalization, now of that 20%, 5% of those would require advanced life support care, like intensive care unit. And those are the ones at risk of. Why? Because they've gotten a severe pneumonia. And now the susceptibility of what they are saying in terms of age per se, people who are older may have other comorbid, it's called comorbid conditions. Like maybe the older you are, the more likely maybe you have diabetes or other infections that predispose you to low immunity. And therefore, if you get these COVID-19, then that may add up to the other disease. And when they combine together, then you may be at a higher risk. But that does not mean that the young are not getting. Actually, in Spain, I think the youngest is a 19-year-old. Although even that 19-year-old actually had a comorbid heart disease. You get what I mean?
Right.
So again, comorbidities are not necessarily among the old only. But age per se increases your chances of having less immunity. But we want to avoid getting it altogether. Because you do not know how it will react on you as a person. But 80% of them would actually have mild disease.
And I'm even thinking because there's a lot of young people who feel invincible. Maybe they've contracted some underlying condition over the years, but have been living thinking they're okay. But then this comes in and brings to the surface other unexpected surprises.
True.
Yeah. Okay. So let's move on to the next misconception. And this has everything to do with heat and humidity. A lot of people in the beginning were saying this is not going to affect Africa because Africa is Hakuna Matata land. It's always hot, it's warm, it's sunny, and we have Ebola. So go away, Corona. We've got this covered. Is there any truth to the virus actually being unstable in very hot environments like African environments?
We hope that's true, but that theory came about because in the last few weeks particularly, there has been few cases in Africa. There had been no deaths in Africa, especially in the belt bordering the equator. And also, if you extend eastwards towards Singapore, which is around the equatorial belt also, the number of mortalities have been relatively low. So they are trying to assign, people generally would try to assign. But because these epidemics started from up north in China, which is in Asia and a bit on the more temperate regions, then spread through Europe, which is again temperate, and people were suspecting maybe there is an aspect of the weather and climate of Africa that may be protective, so to speak. But now only time will tell, because now we've started seeing some of the effects on people who are of African descent who have actually contracted the disease, and we will see. But therefore, you cannot assume that the coronavirus does not affect Africans.